Hi, I'm Dr. George Smolinski, and I'm a board-certified physical medicine and rehabilitation doctor. That's the type of doctor that specializes in sports medicine and non-operative orthopedic care. Today I want to talk to you about platelet-rich plasma injections, and we're going to show you how we actually perform an injection. We do these injections for chronically damaged tendons and ligaments. If you damage a tendon or a ligament, a lot of times it doesn't heal up because there's not very good blood supply. So, what we do is we inject your own platelets into the damaged tendon or ligament to stimulate it to heal up. Why do we use platelets? Well, if you think back, when you cut yourself, eventually it stops bleeding and you form a scab and then you form a scar. The cells in your body that are responsible for that process are platelets. Normally they just circulate through your blood, but then when there's damage to tissue or skin or muscle, they're activated. When they're activated by that sort of damage, they release chemicals locally that are naturally produced by your body that then work to form new tissue. That's what's great about PRP injections. If you have a chronically damaged tendon or ligament, you can inject the platelets right into there and stimulate that tendon or ligament to heal up. What we do is we draw your blood, spin it in a centrifuge to extract the platelets, and then inject them using ultrasound guidance to put the platelets right into the chronically damaged tissue in the tendon or the ligament. So, join us today as we go through how you perform a standard PRP injection. Now before you saw me holding this joint model in my hands. What this demonstrates is a standard knee joint, and what we do is inject the PRP into a damaged tendon like your patellar tendon. The patellar tendon is located between your kneecap and your tibia or lower leg bone. What we do is place the needle right in through here and inject right into the damaged tendon tissue, and you'll see us holding an ultrasound probe over the tendon in order to guide the needle. So the first step is drawing blood. To do that we use a pretty big syringe, and we're going to draw the blood up into that big 60 cc syringe and then spin it on the centrifuge. So here we go. Alright, the next step is loading the blood into the centrifuge. What's going to happen is it's going to be sucked into the centrifuge chamber on the left, spun down, and then the platelets will be extracted into the smaller syringe that you can see right there. So, away we go. Alright, there we go, ready for takeoff. There goes the blood. Now the whole process to centrifuge it takes about 17 minutes. So we'll come back when we have the platelets ready in the small syringe and we're ready to inject. Alright, so this young man has Achilles tendonitis, so we are going to be injecting into the Achilles tendon. You can see what we're going to do here on the ultrasound. Little poke. I like the car alarm going off in the background. Do you think our viewers will like that? Okay, there's the needle. Okay. Some pressure. Okay. Come back, find the needle. There we go. Excellent.
You want any pictures?
Please. Go ahead. See it distending the Achilles tendon right there. Alright, that does it for the PRP injection. So, if you have comments or questions about PRP injections, please post up in the comments section below. We'd love to hear from you. Thanks for joining us, and see you soon.